Many people are taking nutrigenetic tests to try to identify predispositions to conditions such as diabetes, hypertension, celiac disease, among others. Nutrigenetic tests also allow us the identification of variations that influence nutritional status, metabolism and nutrients, body composition, response to physical activity, food intolerances and allergies, tendency to inflammation, oxidative stress, etc. The idea of this YouTube channel is to teach you how to interpret polymorphisms using as an example my own genetic test. Knowing your own or your patient's genetic profile will give you more tools to make the best decisions related to a personalized medicine approach that aims to meet specific nutritional needs for each person. Today, let's learn about the gene ADIPOQ, which contains instructions for the production of the hormone adiponectin. Adiponectin is secreted primarily by fat cells or adipocytes. People with higher levels of this hormone convert more fat into energy, which is great. But those with lower levels of adiponectin find it more difficult to lose weight and also find it easier to regain weight after a calorie-restricted diet. ADIPOQ also acts on the muscle's capacity to use carbohydrates. There is a relationship between individuals with lower levels of ADIPOQ and being overweight, as it tends to increase appetite. In mice injected with adiponectin, their metabolism accelerated. Even in obese mice, the extra adiponectin helped to decrease blood glucose and lipid levels. Adiponectin is also crucial for insulin sensitivity, and as my grandmother and an uncle have diabetes and my parents have insulin resistance, I was super curious to learn about my ADIPOQ inheritance. Do I tend to have higher levels of adiponectin and thus a better insulin sensitivity, or do I tend to have lower levels of this hormone and a higher risk of diabetes and inflammation? For that matter, I browsed my genetic test raw data and looked for the main ADIPOQ polymorphism, their RS 17-300-539. The RS ID number is a unique label used by researchers and databases to identify a specific SNP, which is a single nucleotide polymorphism, a genetic variation. In general, lean people have 40% more adiponectin than obese patients. Although I'm lean, I used to be an overweight teenager, and as a 47-year-old woman, I find it that it's getting harder to keep my weight. So, what to expect when you browse ADIPOQ RS 17-300-539? There are two possible variations in terms of genetic alleles, A or G. An allele is one of two or more versions of DNA sequence, a single base or a segment of bases at a given genomic location. Each person inherits two alleles, one from the mother and one from the father. If the two alleles are the same, the individual is homozygous. If the alleles are different, the individual is heterozygous. So, for ADIPOQ RS 17-300-539, you could be AA, GG, or you could be AG. My genotype is GG. Unluckily, GG and AG genotypes are associated with greater ease in regaining weight after a calorie restriction diet because of the lower production of adiponectin. The G allele is also associated with increased triglyceride levels and increased risk of metabolic diseases. The AA type is what the research shows to be the normal susceptibility to these conditions. The good news is that adiponectin levels can be boosted with movement, associated with the right diet and supplements. Foods such as avocado, olive oil, raspberries, blueberries, and grapes are great. It has been shown that fiber can increase adiponectin levels by more than 60%. Exercise is also vital to increase adiponectin levels. So, if as me, you are a GG type, try to exercise at least 3 times a week and if possible 4 or 5 times a week. Supplements like omega-3, curcumin and zinc can also help to increase adiponectin levels. There is also some evidence that sleeping in a cold environment, which is 19 degrees Celsius or less, can also increase adiponectin, but I have to say that's not for me. Of course, obesity, insulin resistance, and other metabolism-related conditions cannot be explained by one gene variation. In that regard, several other genes have been studied, and I'll talk about them in other videos. So do subscribe and please come back. I'll be waiting.